This one is Russia hospital. That one. This one. The red roof with some elements of white is Russia hospital. Or New Nyanza General Hospital. Currently it's called Jaramogi Odinga Teaching and Referral Hospital. Now this is where my dad was admitted for 3 good weeks. 3 good weeks. He became stable by the 4th week. I have some stories to share about my father experience in the hospital. Number one, he was referred from Homa Bay County Hospital. Reason being, the condition that he had or he was suffering from, which they scanned in Homa Bay and found to be subdural hematoma, acute and chronic, 23 milligrams in size, is a rare condition that affects people who have undergone through serious head injury, probably through an accident or something, but there are also rare cases that affects the elderly people due to old age. Now that's where my dad belongs. So what happens is that there are some brain veins that supply the blood to the brain. So when there is a pressure due to age or due to injury, they burst, releasing blood. So when the bloods are released, the bloods accumulates at a space called cranial cavity. Now cranial cavity is that cavity that is in between the dura mater, which is the brain itself, and the protective layer, the so-called skull. So it accumulated there, and it was magnanimous. I mean, it was enormous. I mean, the size was warranting it to be emergency. So that's why when we are leaving Homa Bay County Hospital, we had to be brought by an ambulance, which actually took 1 hour 30 minutes from Homa Bay to Kisumu. And upon arrival, we were admitted at the emergency center. It's actually called Casualty and Emergency Center, where when the patients are supposed to be admitted direct without any question or anything and be put on management drugs. And I really thank the Russia or the JTRH medical practitioner team for the wonderful work that they did, and empathy and everything that I saw in them, something I totally never saw at Homa Bay County Referral. In fact, I say, if my dad was to stay even for the next 3 hours at Homa Bay, he would have died. He would have died. Because once they realized that they had misdiagnosed, because at first they said he was suffering from pneumonia, which they treated, and there was no change. So for them, that was all they could do. They later left him there, just lying on bed, nothing, no painkillers, no antibiotics, nothing at all. He was just there, feeling pain and every other thing. In fact, not to mention that 2 patients died just close by bed where my parents was sleeping. In fact, to my judgment, they died out of carelessness and lack of concern by the medical practitioner, more especially the nurses, about the patients when they are admitted. They're not keen to check on the condition to know whether it is emergency or not. And so I say it was very unfortunate to see that, and it was very unfortunate for my dad, who was still sick. But that time he could not talk, but he was conscious because he could hear you what you say, but he couldn't respond. And people crying because of having lost their dead one, and they're just left to make a lot of noise within the hospital. I found that to be pathetic. Homa Bay need to do something. Now this hospital, which I'm pointing now, this is where my father's life has been saved, and I'm truly grateful to them and to God for having used them skillfully. Number one, they contained the pain and they prepared his brain for the surgery that was to be done. A very careful procedure that needed careful mind, careful steps. He was taken to the surgeon room on the 8th of January at 9 p.m. over the night. I didn't have otherwise because he had waited for 2 days to be admitted for the procedure, but it didn't happen because we were told the theater was full. I can tell you guys, people are suffering in the hospital. If you want to know why, you need to thank God for the life that you have. Please go to the hospital, not to visit, but make an intentional move to go to the hospital and just decide to even be there just over the night to see how people are suffering. And more especially, please try and visit the surgical wards. I saw people suffering. I saw people die before me just while I'm standing next to my dad's bed. Then a close by patient succumbed the following day, and people die, especially for the short data that I collected, especially 3 in the morning and 4 in the morning. That time when the nurses have gone to rest and maybe the caretakers are sleeping outside or somewhere, resting somewhere. That is the time when they die because no one has monitored to see something that is raising concern. I can tell you for sure, in the acute room number 206, where my dad was finally admitted when he couldn't do anything, he couldn't eat, and so they had to use the GIT tube for his feeding. He couldn't carry up his head, he couldn't speak. The only thing you could know that he's still alive is that you could look at the chest and see it moving in a way of the heart is pumping. I tell you, it was a time only to hold on to God, and it was so painful to see a close by bed the patient is succumbing, is dying when my dad is fighting. And when finally it reached a point where he had to be removed from that room to the next subacute room 205, we thought that everything was okay. Let me tell you again, 3 people died in 205. And then he was finally released to 204. Remember when after operation he was taken to 203 because he was very stable. That despite the doctors thinking that he's supposed to go to ICU before the procedure, after the surgery they were disapproved, and my God, dad was stable, SpO2 was okay, everything was okay. And I want to tell you that very soon my dad will be discharged and we will be leaving the city of Kisumu. We will be taking him home for home-based care and for his recovery. His status as per now is very stable. His conscience is fully back. He can talk, he can reason with you, and he can eat. Greatest of all was I was happy to see my dad yesterday taking food by his own hands and eating, holding a cup of tea on one hand and bread on the other hand, and to see him in the evening eating ugali and kuku and mboga. God is marvelous. So this hospital will remain in my mind for history. And just this other side is Kibuye, where we were purchasing most of the things. You see Kibuye Market? Kibuye Market is here.